Hey there, Malton-Schexneider here with EraseYourBackPain.com, bringing you the most frequently asked questions I get about sciatica and back pain. These are questions submitted by people just like you from all over the world. And who knows, this may actually be your question. So let's get straight to it. I get all kinds of questions related to alternative treatment approaches for sciatica and back pain. But by far and away, the most frequently asked question is, will decompression therapy help my sciatica or back pain? First of all, decompression therapy or spinal decompression is nothing new. In the old days, we simply called it traction, and it's been around for a few thousand years as a means of treating the spine. What is new is how it's marketed. Here's what you should know. First, spinal decompression therapy can help alleviate symptoms by reducing the pressure on the disc, assuming, of course, the disc is the source of the problem. Secondly, it's very expensive, and most insurance companies don't cover the cost. It's not uncommon for a spinal decompression regimen to run between $4,000 and $5,000 for 18 to 20 sessions. Finally, most spinal decompression advertisements boast of an 85% success rate. The truth is, this benefit is temporary, and the reason it's temporary is because the minute you get up, normal loading of the spinal elements resumes. You simply can't maintain the normal disc height from being stretched by spinal decompression. Although I like the idea of spinal decompression, it is not in and of itself a panacea for the treatment of sciatica and back pain. But when spinal decompression is combined with appropriate patient education and targeted medical exercise training programs and spinal bracing, you now have the tools you need for long-term health of your spine. Over the last few days, I've answered your most frequently asked questions about sciatica and back pain. I hope my answers have helped you understand your condition just a little better and perhaps have given you some hope for a speedy recovery. And while these FAQs are helpful, I want to make sure that I'm answering the most relevant sciatica and back pain questions, the questions you should be asking. So I've put together a list of questions I'll be answering over the next few days to help you become a more informed sciatica and back pain consumer. Utilizing the information I'm going to provide you, you'll feel better faster and stay that way. Here's what I'll be covering. What can I do to prevent sciatica and back pain? When is spinal manipulation best utilized? How can I be certain I have the best doctor or therapist treating my condition? How should I prepare for surgery? What type of work places me at greater risk for sciatica and back pain? What lifestyle habits place me at greater risk for developing sciatica and back pain? What are the best medications to use for back pain? What is the best treatment advice for back pain? What are the best types of exercises to treat back pain? And finally, what is the most effective surgery for a herniated disc? Well, that about wraps up my top 10 frequently asked questions about sciatica and back pain. Don't forget to be on the lookout for my series on the top 10 questions you should be asking about how to get rid of your back pain. And remember, if you're hurting now, do something about it today. Go to www.EraseYourBackPain.com/program and check out my 4-step system for stopping sciatica and back pain dead in its tracks. You'll start to feel better fast and begin enjoying life again. All good health to you, and I do hope our paths cross soon.